So today I was finally able to get information in regards to the mental health initiatives that are available in Uganda's primary healthcare system. And according to a reliable source, we have the village health teams at village level that are on ground to identify people with mental health needs at village level and refer them to the hospital. And they are referred to the health center too. So at village level, you have your health center too. If you have a problem, you just check into the health center too, and they will be able to help you. And then at health center threes, we have a psychiatric nurse or a psychiatric clinic officer who is there to attend to your mental health needs. And the clinic officers are available in some instances. For some hospitals, they don't have. They only have a psychiatric nurse, but all in all, you have a psychiatric nurse at Health Center 3 to attend to your needs. Okay. Then at Health Center 4, we have both the psychiatric nurse and the clinical officer ready to attend to your needs. They're available, and if you need help, you just check in. Then at hospital level, we have both the psychiatric nurses and the clinical officers that are able to assess your situation and then help you according to what you need. So they are available, their numbers are dependent upon the capacity of the hospital. Then at regional level, we have the psychiatric nurse and a clinical officer, but also a psychologist. Psychologists have not been there at regional level in previous years because the government had not yet absorbed them. However, since last year, the government has started to absorb psychologists into the healthcare system, and so be sure that you'll find at regional level, you'll find a psychologist who is available to assess your needs. And then we have at national level, we have Butavika Hospital that everyone knows. And when you check in there, you have your psychiatric nurses, you have the clinical officers, you have psychologists to address your needs. So these are some of the platforms that are available. And what I wanted to say is psychologists have not been practicing because they were not absorbed into the system. However, since last year, they have been the government has started absorbing them into the system, and so hopefully with time the practice will grow and they will be more accessible. And so what I need to encourage you to do is, if you need help, these are the platforms that you need to get to in order to get help. Yes, so I needed to do this video and I'm glad I did it. Find help when you need it, okay? And I wish you the best.